According to the Organization for Economic Cooperation and Development, the United States spends more money per person on healthcare than any other developed country. With rising insurance and prescription costs, along with access to care, Americans are seeking alternatives to coverage. Some Americans believe that the healthcare system has not improved. During the 2020 campaign, Biden emphasized improving the healthcare system, specifically to the ever-rising cost of health insurance.
If I have the honor of being president, I promise you I will lead. That will begin with a dramatic expansion of health coverage and bold steps to lower healthcare costs. We need a public option, now more than ever.
2 years into his administration, some Americans have yet to see the relief promised by the president. Many believe that healthcare costs are rising and access to care is limited. To understand more, we spoke with D.C. House Call physician Dr. Ernest Brown about the current state of healthcare in America. Dr. Brown left the traditional healthcare environment to focus on meeting his patients where they are, in their homes.
I think medicine should really be more of a social endeavor for the good of all. Because if you think of it like this, medicine is to keep people healthy. If your people, your citizens are healthy, your country is healthy. We spend 25% of our GDP on healthcare. No other country does that. But we're not healthier.
The last 2 years have placed an additional burden on the healthcare system due to overworked health providers, facilities at capacity, and the uninsured. In comparison to other large, high-income countries, the U.S. COVID deaths per capita are the highest.
So the pandemic was very challenging. Here in the United States, we certainly weren't prepared for it. Nobody really was. To the extent we had to really hustle to figure out how to do the testing and how to take care of those who became positive.
As the U.S. shifts from pandemic to endemic, the focus on how to improve healthcare is top of mind for most Americans.
They lost their health care at the beginning of a global pandemic. Like, that's horrible. And then to see so many people who are people experiencing homelessness that are people with medical issues, and the reason that they're experiencing homelessness is because they can't pay medical bills, that really shouldn't be happening in a first world country.
There are a lot of people living paycheck to paycheck, and health insurance is it's a luxury to have, whether it's dental, vision, just regular health insurance. And not everyone can afford that luxury.
I think the whole thing needs to be redone. We need to get big business out of it.
Insurance is becoming a privilege, and it shouldn't be a privilege. It's a right, like going to school. You should have insurance. That's what we believe.
Insurance still seems to be a privilege in America that only people well above the poverty line can afford. On the other hand, 49% of Americans are insured through their employer, while the unemployed deal with the consequences that occur without coverage. Dr. Ravi Perry is the chair of the Political Science Department at Howard University and is specialized in minority representation. He knows the difficulties about healthcare and the associated cost.
You don't have a job in America, then you likely don't have insurance. And so that means that healthcare is attached to your employment status, and your employment status is attached to your livelihood.
Never in U.S. history has the Senate been so balanced between Democrats and Republicans. This makes it kind of difficult for the government to enact new legislation and push through important aspects such as the transformation of healthcare in the Senate, and also against the interests of pharmaceutical companies.
As a politician, it is suicide to oppose insurance companies and pharmaceuticals. You won't get reelected. So you have to think about it. How will change occur? A change occurs from patients, from the people, if people demand it. But at this point, I think it's got to get whole lot worse before people wake up and make a change.
It shouldn't be a president's job to say what the healthcare system should look like. Dr. Ravi Perry emphasizes that access to healthcare is better, but low-income families should not have to decide between sending their child to college or paying the medical bill of an elderly loved one.
The question, of course, for Americans is always, who's going to pay for it? And people want that answer before they perhaps even want access to everyone. And I think I think there's a lot of correlations here.
He adds that the problem in the American political system is that only 30 to 50% of citizens vote in any given election. As long as politicians remain in office, there will be no change. The only way that we can fix this is by voting them out. During our street poll in Washington, we want the people to tell us what they believe would change the healthcare system in the U.S.
I do think it comes down to our politicians to lead the way and to set the standard and to cap the profits for the insurance companies as it is now. And then, I think at least Biden said insurance companies need to pay for COVID tests. But other than that, I haven't seen that much that he's done in terms of making our insurance work better for the general population.
That they should make it open for everybody, not just for the poor, everybody.
People would support public health care where everyone has access to the medical care that they need. Furthermore, America has been struggling with the shortage of nurses for years. Dr. Brown would also choose to not practice in a hospital or similar facility.
We have a nursing shortage here in the U.S. nationally. It's a crisis. And what drives that? Why would anybody in a healthcare system that's purely for profit break their backs every day to do the job that they should be rightfully paid for and not get paid for it? In fact, anybody who asked me, would I do medical school again? Not here. I would do it someplace else.
Looking at the different views we have received in terms of healthcare in the United States, there is great agreement that the healthcare system needs improvement. This not only means easier and cheaper access to medical care, but also combating long-term health problems in the American society and finding solutions to the shortage of nursing staff.